Hi, Dr. Lisa Hamilton here with Hamilton Vision Center located in Centennial and Littleton, Colorado. One of the main concerns for our patients, especially 50 years and older, is macular degeneration. That is the leading cause of blindness in our older population. And so many of my patients will say, my dad has this or my mom has this, and I'm really afraid that I might be at risk. And they want to know, do I have macular degeneration? We definitely have all of the medical equipment here needed to evaluate for that. We do images of the back of the eye. We do cross-section views with a device called an OCT. But what we also have here, which really sets us apart from other optometry and ophthalmology practices, is we have the Adapt DX by Maculogic. This one can detect macular degeneration 3 years before we can see it physically. And basically, it's like a little VR device. We'll adjust it to fit you. There's a gal in there talking with you, and it measures how many minutes does it take for the eyes to adjust to low lighting. And the medical term for that is dark adaptation. A lot of us might recognize this. For me personally, when I've gone into a movie theater and I can't see, I've arrived late, it's already started, I'm tripping over the steps and I can't see well. And then I sit down and I've been in there for a bit, and then I look around and go, wow, I can see pretty well in here now. That's because my eyes adapted to the low lighting conditions in there. A healthy retina that is not suffering from macular degeneration will adapt to low level light within 6.5 minutes. And if it's taking more time than that, we have a 90% chance that this individual is already on a path toward macular degeneration, which allows us to get a baseline and then talk about different things we can do nutritionally, stop smoking, elevate the carotenoid levels, which we have a device here to check those as well, make diet recommendations, supplement recommendations, and we can repeat this test to see, is the condition getting worse or are we holding? And we can kind of tell if what we're doing is helping. If you're someone who's concerned about macular degeneration, sometimes this test that checks for your dark adaptation time will be covered by your medical insurance. And if you qualify for that, we can bill your medical insurance. If you don't really personally have a diagnosis that would qualify you, you're just concerned, we can offer a free screening for you. It's just a pass-fail test though. And sometimes people will fail the screening and they we'll bring them back then. That will justify billing for the medical insurance, and then we can see what the true time is. The test cost is really $69, so a lot of folks will just go for the longer version of the test and pay, just pay out of pocket for it. And we're happy to take either approach you like. So if you'd like to have this test done, you can call us or you can go online. And if you're already a patient of ours, then you can just say, I'd like to have that dark adaptation test done. And you can specify whether you like the free screening or you'd like to just go ahead and go straight for the extended version. And if you're new to our practice, we'd like to perform a comprehensive eye exam first and then order this other test on a different day. It's hard to do this test on a day that we've had bright lights in your eyes. And the test itself can take some time, so we don't want you to be overly tired from going through an eye exam prior to doing this.